So in this video, we're gonna dig deeper into the software by getting to the main page. The most important page is the patient charts page. So here, just choose patient from the patient page, and then you have direct access to the patient medical record. So this is how it is organized. So you have two side panels, left and right, and then a middle panel here where you have your progress notes here. Okay? So let's start. On the top here, you have just very important information for the patient. So patient name, age, date of birth, chart number, um, email address. Here, as you can see, this hyperlink. So if you click here, you're gonna write the message to the patient, not to the directly to the email, but to the patient portal. This is the phone number and the next appointment. So right now, there's no appointment scheduled. Okay. So we're going to start with the 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 panel in the middle. Um, so here you have all your progress notes. You can scroll up and down, um, and uh, as you can see here, you can choose to have the most recent on top. If you click here, can have the most recent on at the bottom. It's just a personal choice. I would say personally, I would use the most recent on top because it's the most convenient. You don't have to scroll all the way down once you log in. But some people like the bottom. So most recent on top, and then with these double arrows, you can go. So you don't have to scroll. You just want to go to the top of the page directly. Or you go to the bottom of the page. You go directly to the bottom. Okay. All right. Now you can fold all this so that you have an overview. Fold, and here you go. You have all your progress notes, and you can click on each individual note to open it. Okay, click, open, and close. You want to unfold everything, you can do. You can refold everything. Okay, and you know that this, for example, this was from Dr. Torrance, written on at that time. It's a clinical note. This one is a prescription, etc. You know, then you can have, if you don't want to scroll all the way here, you can have everything unfold in one file, so it doesn't have to load. So you click overview, and you have everything here. You could So everything is open, and you can scroll very quickly here. So that's the overview. Um, then of course you can search for anything pretty much. You want to search only the prescriptions. Mm, yeah, and this will show you only the prescriptions. Okay, or any notes that includes the word prescription. Okay, yeah, this appears because it was prescription here. Okay, so you can sort, you can filter by anything here, even the date. Um, yeah, so this is how are the progress notes organized. So let's see an individual progress note. So let's see, for example, this one. That was made by Dr. Torrance at that time. It's a clinical note, and that's the text, the actual text. And you see here is created the first time by Dr. Torrance at that time. It was updated because I can see this version. There was a version 1, version 2. So it was created 923 12, and there was another version created a few seconds later, 923 39. And you can see, if you want to see the first version, you can see all the versions. You click here. Here, this V1, version 1, version 2. So that means any progress note you type cannot be deleted, and that's a medical legal requirement. You cannot once you save it, you cannot delete it. You can only create a new version, but the first version, the previous versions are going to be stored. Yeah. And any modification will create a new version. Yeah. Um, you can yeah, so you can create a new version here by clicking edit. You can build a visit. We'll talk about that. Calvin AI, I'll explain. So Calvin AI uh, will help you manage the patient. We'll dig deeper into that later. Rewrite, that's also an AI feature which actually takes your text, whatever you wrote, and turns it into a nice text with sentences and something really nice. Um, and here you click here, you can copy it to the clipboard. So let's create a new note. So click new here. That's the clinical note. You can use templates. So you can write here as you want, like a freehand writing. You can use the microphone, or you can use a template. We had a lot of templates. Okay, you can create your own templates. But for example, here, cervical trauma. Click. Um, well, this is a series of questions. Maybe not the best template. Chest pain here. Okay. So that's the template. Patient coming for chest pain. And of course, you can create your own templates and copy template and modify it, remove a template. Um, yeah. All right. So you have your template. Then you change it accordingly to how your patient is, and you ask all those questions. And as you can see, this is really um, a like very short, not detailed progress notes. It's really a progress note pretty much. But if you and then you can save it. Let's save it. Save and sign. All right. So there you go. So that's version 1. But let's say you want to turn this into something nice, a letter. You say you had all these findings, but you say no, I want nice sentences. You can just click here on rewrite, and AI will take care of that. And as you can see, so that's the new version. And if you like it, you can just save it. Save. Okay, that's the version 2. So let's check the difference between version 1 and version 2. The version 1 here, like these are very short, like here, left-sided chest, 3, 4, 10, LUE, blah, blah, blah. So this is very short. And then version 2 here, presenting complaint, patient present complaint. So left-sided chest with severity referred to the left upper extremity and no precipitating factor. So this is much nicer, but the magic is you don't have to write or even dictate. Uh, AI will change this into this automatically. Of course, you have to proofread that, make sure that that it's accurate, that there's no new information, or that you didn't lose any information. Um, but see, in one click, you make your notes much nicer. And this will look good if you, let's say, if you have an audit from the college, they like to see nice progress notes. Of course, here, all right. So, and you can see it was updated a few seconds later. That's the time of the when I clicked the um, rewrite the button. Okay. All right. Next is Calvin AI. So Calvin AI, we turn this into a prompt and ask the AI how to manage the patient. Let's try Calvin AI. So this is how it's pre-populated. So that's the prompt that the software prepares for AI. Okay. So introduction. Hello, I'm a doctor. So it's important for AI to know that you are a doctor. 26-year-old male. So this comes from, we know that comes from the software. Okay. Presenting complaints. That's actually your progress note. Okay. Then you can attach some documents here, some more information. You can add some more information here. Uh, Same thing for here, and then questions. So these are pre-made questions. Okay. For the prompt. So what question should I ask for a focused medical history and review system? How should I conduct a focused physical exam? What test do you suggest? The 5 most probable diagnosis and the probability percentage, and the treatment, the follow-up, degree of emergency. Okay. And then you can add reports data and you can submit. So once you submit, you have, there you go, you have your answer. Focused medical history. So it was a chest pain. Okay. Chest pain. So you need to collect all this information, review systems. The focused physical exam should be like this. These are the tests you should order. The 5 most probable diagnoses are here with the percentage based on patient age and based on all the information that was provided to the AI. Treatment of the most probable diagnosis. So the costochondritis, that's how you treat it. GERD, that's how you treat this, and anxiety, that's how you treat it. Recommended follow-up in 3 days. Degree of emergency, 8 out of 10. Okay, and then you can take this and make a new click a note, and then modify it. Say, you have this, and then you can just add, onset of chest pain yesterday, 6 p.m., and then you make your notes. Yeah? Okay, cancel. All right. So that's how you do the progress notes, and of course you can build the visit, and it goes straight to the billing. It pre-populates with everything, and then at the billing, you just have to add the diagnosis code and billing code, and then save. Okay, and then you can just come back to your patient. By the way, just as you probably notice now is everything is in one window, one tab. You can go back, go forward, um, and everything you type is saved. Um, so there's no multiple windows open. If you want to open a new window, for example, you say you want to keep this tab open, and you want the calendar in a new tab. So if you have a Mac, click uh, Command and click. If you have a PC, you type Control and click. So for example, calendar here, click, and then it opens a new tab here, and that's the calendar, and you can go back. So you can have, if you want, multiple tabs, but by default there would be only one tab. Yeah. And also you can if you want to close everything, you can close, or you can open everything. You can unfold all here, and unfolds progress notes and the side panels. Okay, and we'll talk about the side panels in the next video. Um, okay,